Hello everyone, my name is Heather Good, and here is my presentation on sensory processing disorder. The cause of sensory processing disorder is still unknown. However, there have been consistent standardized test results that show that they may be caused by dysfunction in the lower levels of the brain or microscopic levels having to do with synaptic regulation, and also inadequate transmission of neural impulses due to poor integrity of the myelin sheath. The characteristics of SPD are as follows. There are two types of neurological thresholds: high neurological threshold, low neurological threshold, and there are also two types of behavioral responses: passive and active. Now these combined together form the four categories: poor registration, which is high neurological threshold and passive behavior; sensory seeking, high neurological threshold and active behavioral responses; sensory sensitivity, low neurological thresholds and passive behavior responses; and sensory avoidance, low neurological threshold and active behavioral responses. The common symptoms of SPD are as follows. Number 1, fluctuating or extreme responsiveness behavior while engaging in everyday activities. 2, difficulty with the environment in play, learning, social situations, and engaging in other developmental activities. Dyspraxia. Number 3. Number 4, ideation. Number 5, adaptive responses. 6, it may present as along a continuum of under responsivity to over responsiveness, of multisensory processing and sensory seeking. 7. Tactile processing dysfunction manifestations include deficits in modulation, which presents as tactile defensiveness and under responsiveness to tactile stimuli. Continuing in tactile processing dysfunction manifestations is the deficits in tactile discrimination. This presents as difficulty interpreting tactile information in an effective manner, and also difficulty with localizing tactile stimuli. Lastly, with tactile processing dysfunction is the impaired stereognosis and decreased fine motor and eye-hand coordination. This affects writing skills, cutting with the scissors and knife. 8. Proprioceptive processing dysfunction manifestations. To name a few: distractibility, clumsiness and awkwardness, poor awareness of personal space, and seek heavy resistance and pressure. Number 9. Vestibular processing dysfunction manifestation, which presents with deficits in modulation, vestibular discrimination, low muscle tone, poor endurance, poor motor planning and sequencing. Behavioral response include difficulty with attention, organization, behavior, communication, and scale tone, postural ocular deficits, decreased balance and equilibrium distraction, and poor bilateral movement. And lastly, uncommon symptoms include sensory-based motor disorders. The functional implications which are impacted include play skills, social activities, capacity for self-regulation, and academic learning. Impact on development include cognitive, language, social development, and adaptive behavior. The specific considerations for the occupational therapist to take into account is it is necessary to observe the child in their natural environment, That way you can identify any sensory issues that may be present. You need to consider the child's age, expected play skills, social activities, capacity for self-regulation, academic learning, and understand the why behind the behavior. And also would want to start down with a top-down approach. And this concludes my presentation. Thank you, and I hope you enjoyed the slides.